I welcome you all to our today's health talk. And today I want us to have this ample time to then discuss a very common complaint that most of the patients do present with to our various health facilities. Now, this complaint is called edema. Now, what do you understand by the word edema? So, edema refers to the swelling or puffiness of the body, which actually occurs as a result of excess fluid retention within the body tissues. Now, there are two major types of edema, and this classification is based on either one, edema based on the site of occurrence, and number two is edema based on the characteristics. So let's start with the first one, which is called edema based on the site. The first example in this case is called the peripheral edema, and this can sometimes be referred to as edema of extremities. The second example is called the pulmonary edema, and this type of edema is sometimes referred to as lung edema because it is fluid retention within the lung tissues. The next example in this case is called the cerebral edema, and this is fluid retention within the brain tissue, or sometimes referred to as edema of the brain. The fourth example in this case is called the macular edema, and the fifth example of edema based on site is called the sacral edema. The next example is called the peritoneal edema, which is sometimes referred to as ascites or the abdominal edema. The last but not least in this classification is called the anasaka, and anasaka simply means generalized edema, and therefore this is edema of the entire body. Now, the next classification is based on the characteristics, and there are several examples in this case. The first one is called pitting edema. The second example is called non-pitting edema. The next example is called tender edema. And the last example in this case is called non-tender edema. Ladies and gentlemen, as we move forward, we want to have a look at the various causes of edema. And for the sake of this presentation, we want to look at the most common causes of edema. Now, the first one is called heart failure. And heart failure is also a very common illness. And one of the key presentations or clinical signs of of heart failure is edema. Now, the next cause of edema is kidney failure. Kidney failure and heart failure are like brothers and sisters. They both present with edema. The next cause of edema is liver failure. And the fourth cause of edema is called prolonged immobility. For example, a long hour of flight, or if one sits in one position for a longer period of time, that is what we call immobility. And when that happens, one can easily develop edema. The next cause of edema is referred to as burns, especially the scald burns. The next cause of edema is infections or even certain inflammatory processes, for example, arthritis. The next cause of edema is menstruation, as witnessed in some ladies that during their menstruation they do develop body swelling or even the peripheral swellings. The next cause of edema is as a sign of menopause. So menopause can result into edema in some women. The next cause of edema is pregnancy, and this is also very common. And therefore, it's also a danger sign in pregnancy that any woman developing edema or even lower limb swelling stands at a very high risk of developing certain diseases, or edema in pregnancy may point out to a serious underlying illness in that particular woman. And therefore, any woman who comes with lower limb swelling or generally edema or swelling of any part of her body must be thoroughly investigated. Patients who come with a preeclampsia or even eclampsia do present with edema, and therefore a lot of watch should be taken in this case. The next cause of edema is malnutrition, as seen in 1. kwashiorkor, 2. marasmus or even marasmic quash. The next cause of edema is the head injuries, as seen in traumatic head injuries. We can also have tumors of the brain. The next cause of edema is allergies, and this is also a very common presentation to patients who have developed allergic reactions. The next cause of edema is called lymphedema, as seen in patients who suffer filariasis, who have been infested with filary worms, for example, the Wuchereria bancrofti. The next cause of edema are certain blood disorders, blood vessel disorders. For example, patients suffering deep venous thrombosis, simply referred to as DVT. Patients suffering varicose veins can also develop edema. The last but not least cause of edema is referred to as thyroid diseases, and in this case there are several. It can manifest in either hyperthyroidism, hyperparathyroidism, hypothyroidism, or even Graves' disease, whichever. Now, ladies and gentlemen, any client presenting with body swelling or edema, if you may like, must be taken with a lot of seriousness. Thorough investigation must be done to that particular patient to actually ascertain or confirm the actual cause of that edema. And then quick medical intervention should then be taken off. If you are watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.